Bueno, vamos a ir comenzando ya, vamos tomando asiento, mientras que regresamos de la parte de los sponsors. Bien, y ahora tenemos una conferencia maravillosa. Tenemos aquí a un doctor maravilloso que nos va a hablar de algo realmente transgresor y muy potente. Así que, bueno, simplemente quería contaros, el título de la ponencia es nada más y nada menos que terapia ANF, neuro-frecuencia aplicada a la medicina. Así que damos y recibimos con un gran aplauso a nuestro doctor Mikel. Welcome, Mikel. Thank you.
Is it on?
Okay.
You guys can hear me, right? Good morning. How are you? Okay. I'm going to take you on a little bit different journey when it comes to medicine. My background is neurological and biochemical medicine and school medicine. And 30 years ago, started to look about and try to understand pathologies and the problems in the human body and start to get a little bit depressed about symptom treatment. So I went a little bit deeper. So I'm going to talk to you about neuro-frequency applied to medicine. So the key learnings here is to understand is the power of the neurological system and the biochemical resources of healing. We need in medicine to understand the pre-process of pathologies, not the end process. Neurological frequencies and fusions. We need to understand the fusions and the neurons is billions and billions control everything that action is in our system. Everything else is just a bifunction. We need to understand the neurological oscillation is controlling the aging, is not the number on the paper. I'm soon 59, but my neural oscillation is massively strong. Don't I look like I'm 15? Why are you laughing? Introduction to addressing neuron oscillation weakness. The nerve system is the key, my friends. An innovative approach to healing that neutralizes the obstacles and by using strong neural oscillation. It sounds like Greek, right? Let's try to make it worse. So this is me. I look older here. It's before I invented this. Understanding the source and underlying cause of health issues. I asked all of my professors, if we have Parkinson, how do we get it? And he said, why do you want to know? European research, this is blah, 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 it's about me. But if you want to know a lot more, I'm here 3 days, so you have a lot of time to talk to me. But this knowledge developed to the invention that we work with today since the last decade, that I'm super happy to use on all kind of pathologies without any chemicals or any supplements or injections. That's why I never worked in a hospital, even though they do a good job. Neurofrequency medicine brings answer to what is aging. It's a lot of talk about aging, but do we really understand that? Who invented the number, I'm 58, I'm 52, I'm 38? Who invented this system? For what reason? In the biochemical function of the human body, it doesn't exist. It's lack of resources and weak neural oscillation. That's all. The neural oscillation, the nerve system, controls the production of every resource immune response the system have. We as humans only need to provide this with the resources it needs by eating properly, drinking water, and not be fanatic with food. What are symptoms? Symptoms is an end process of something. That's why we treat symptoms. Because to understand the pre-process, it's very, very difficult. That means we need to find the patients very early and to understand it. This is why we can only do something in the end process. And for many of my colleagues that work in hospitals around the world, it's super frustrating. All take this job because we want to help, same as you. We want to make a difference. But when the patient comes in the end process, I'm limited. And this is not so good. What is the history of neuro-frequency? I mean, when I looked into the deep, deep understanding of every single neuron, how it works, every single cell, how these fusions is doing, I start to understand things. Things they understand for a long, long time. 3,000 years before Christ, they understand the importance of the neurons. What happened? Nerve system controls everything. Cardiovascular system, lungs, liver, nothing works without the nerve system. End of story. We can be specialists in anywhere, but in the future, and I hope I will be part of that change, by increasing and repairing the neurooscillation, we will save lives. 3,000 years before Christ, Leonardo da Vinci, Edison, Einstein, Tesla, all of them did massive research of the neurological function. Tesla would never invent electricity if it didn't get the idea from the nerve system. The fusions, the body's positive and negative. Edison would never invent the light. Da Vinci, he was before his time. He digged up corpse to understand how the human body works. 1875, they invented the EEG and EKG machine to measure the brain and the heart waves. Right now, I work a lot with the brain waves. And this is an end process. But what is the pre-process of the cardiovascular system to make these patients feel better and to repair it, to increase the oscillation? We need to understand the resources. We need to understand the human body's biochemical priority line. We need to understand the influence of hormones. What is hormones? Can anyone answer what is hormones? No? No one? It's chemical cells that have two functions. One, individual. The second one is create collaboration between the human body's glands, organs, and resources. That's hormones. Most of you probably know the most 2-3 normal ones: hormone, estrogen, progesterone, testosterone. The female body have more and over 500 different chemical cells. The male, we are easier. We only have like 100. It's good for us. My life is easier than your female. The future of medicine is frequencies. I am sure all of you have seen this from Einstein. I guarantee all of you it is. It doesn't mean should we trash everything else? No. It works together. Every medical resource we have need to work together. Nothing is so unique we can live without it. Neurological frequencies is an end process result of fusions between cells and neurons. We have 86 billion neurons only in the brain. We have 200 basic human cells that become billions, depending where they are, because they're changing, because they fuse with different neurons and the cell become another cell. I will not go too deep in this. These frequencies controls everything. If you have anxiety, if you have depression, That's the cause of cortisol poisoning. Your body have maybe an invisible problem. We can find out for you. MRI and CAT scan cannot. Maybe you have mood swings. You start to change your weight. Your life feels like, sorry my English, shit. Cortisol poisoning. Cortisol is protective, stage 1, 2. But stage 3 and 4, it put all your protein, calcium synthesis, microbiota to rest. Hey guys, don't work. We have a problem we need to fix first. That means it steals all your energy, all the ATP, everything in your protein synthesis, musculoskeletal, everywhere to try to solve it by an immune response. How can we feel happy without energy? No, then we start Google. I doctor myself. Then it's when it's getting really bad. Then we go out and buy a lot of stuff. So, using frequencies to optimize the oscillation of the nerve system by restoring the normal biochemical resources. What is so amazing with ANF therapy is that we are sending with this device a correction frequency, a neurological frequency. It's not the radio frequency. It's not the resonance frequency that is reflecting. This is very unique because it can create fusion between cells. Over a decade, we have clinical evidence of this. Frequency acts as a connection between the organ and glands. And think of this for a second. If I don't have a nerve system, can anything work? Can I think? Can I feel? Did you know that your emotional nerve system, okay, now we take ladies again, is 10 times stronger than the action frequencies in the nerve system? Everything you feel now when I speak, okay, this Swedish guy is crazy, or whatever, is a response from your cortisol and how your body feels. We are dressed and we are raised to be negative. And if you feel, your emotions control everything. Much stronger than your brain. Brain is only number 5 in our priority and immune response. Remember that? Okay, I don't know how to do this in 25 minutes, so I try. Neurological frequencies. We have between 5 and 15 million measurable and processed frequencies. We have maybe 100 or 1,000 times more that is not so measurable because they're so fast or so slow. Every neurological branch, every nerve we have is changing the frequency everywhere in the body. Our spinal cord that is producing the mother frequencies is between 10 to 50,000 gigahertz. Every branch it goes out is changing because our average body works perfectly between 68 to 72 hertz, which is nothing. Our brain between 4 to 7 to 10. End process, not pre-process. For decades, they have tried to solve this problem to increase, repair damaged neural oscillation or enhance it. Until today, it's been impossible. And I'm so happy we do it every day today in over 80 countries. It's the first time in Andorra, Czech. I'm very happy to be here. Neurons and fusions. In the human body, we have, as I said before, 200 basic main cells that become billions of different cells. In university, we use a lot of time to understand the nucleus, the proteins and stuff. But what happened when we fuse it? Dear professor, what is it doing? Do I need to understand the inside the cell, or do I want to understand what it's doing? Because every cell changes action in different parts of the body. Millions of different neurons Only in the brain, as I said, we have 86 billion. Listen to that number, 86 billion, and less than 100 supramotoric neurons. That is massively important. Fusions among different cells create different millions of fragments. The body is also amazing to recycle herself. Like she talked about glutathione, that is the only antioxidant recycle itself. Glutathione contains more than 50 to 100,000 fragments to become an antioxidant. These fragments, they become amino acids. They become other resources. The body doesn't waste anything. This is really cool. Because these resources is used to produce chemical cells, amino acids, ascorbic acid, vitamin D3. In the liver, we have more than 520 biochemical functions. The liver is the key for your life. The outcome controls and optimizes our lymphatic system. Lymphatic system is your immune system. 600 to 800 lymphatic knots that contain 5 different immune responses. B cells 1, T cells 1, 2, B cells 3, NK killer cells. 15 liters of lymph is our immune system. We only have 5 liters of blood. The lymph system comes before the cardio system. End of story. And this is how we work. Every day in our clinics, we see patients with lymphatic inflammation, mood swings, unexplained fatigue, sick all the time, tired of life, because it's so much bigger than the other systems. The Western medicine today don't understand this collaboration, nerve system, lymphatic system, the cardio system. The 3 musketeers. Without those 3, we don't understand anything. Because we need to understand the biochemical fusions. We need to understand these resources. When we talk to our patients, we need to take time, in my world anyway. Poor understanding of the neurological biochemical functions is not the doctor's fault. I learned the same. University is like this. We teach you like this. Don't think like this. You think like this. End of story. That's Ministry of Health. I meet a lot of colleagues that now take this into the clinics and hospitals and are so happy they can make a difference and really help. And that is, for me, really cool. So, have you ever wondered about these symptoms? How many of you here, up with the hand, recognize one of these? Be honest, come on. 2 hands, I like that. See. I guarantee all of you, I can just examine you with my hand. In 5 minutes, I find a problem in you. This is so normal. This is really normal, but it shouldn't be there. How many of you have sleeping disorders? Yeah? Very cool. How many wake up exhausted in the morning and not fresh and want to out and run? Good, thank you. Okay. Neural dysfunction. A cell or a neuron that is affected by inflammation. We learn inflammation is immune response stage 1, right, but not stage 2, 3, 4, 5. It becomes chronic. The nerve system cannot create strong frequencies that is necessary for important fusions. Toxins increase. Chemicals, negative bacteria increase. We start to get cellular mutation or worse, dysfunction and disease. The strong frequencies are our main frequency. We need to have those to be able to function normally. End of story. Neurological dysfunction create biochemical dysfunction. Only one system controls everything. If you can prove otherwise to me, you are really, really, really good. Neurological oscillation are most to prevent low immune response. We need to have constantly, when you're sitting here, if you think this is rubbish or whatever, you have an immune response. If you cross your arms and looking at me and say, oh, what's this guy? You have an immune response. Your feelings is created by chemical functions, not you. Biochemical fusions are the most important for optimize our body. Okay. Damaged neurooscillation. Primary reason for patient health complaints. The symptoms I told you before, you will definitely hear from all of them. Slow healing and long recovery time. Develops inflammation that will become chronic and inflammation. Inflammation, stage 1, to move blood, nutrition, so blah, 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 is good. But when the inflammation doesn't go away over a certain time, it also tells a lot of functions in our system, hey guys, you need to wait. We need the cortisol here. The cortisol control your mood. Poor biochemical functions, poor immune response, poor lymphatic functions, common health complaints, injuries and disease. Remember, all autoimmune diseases, the incubation time is 10 to 40 years. Before, when you would wake up one day, maybe have fibromyalgia or anything else, you're going to an end process. You had the symptoms 10, 20 years before. And this is what we do by enhancing and repairing the neurooscillation, is give the body a chance. Because it have all the resources. It's just one frequency or connection that is missing. We need to find that out. Silent killer, invisible inflammation. 2004, Time magazine made a huge article on this. If you find it, read it. Because this is killer from inside. And this is what I said before, it takes 10 to 40 years to develop a chronic autoimmune disease because of this. Visible inflammation occurs due to mental or emotional trauma. Nothing is more dangerous for us when it comes to develop diseases than emotional trauma. Many patients come to me that are in middle age and have severe problems, and I talk to them about this. Did you ever had an emotional trauma in your life? No. Really? No. All was good. Then one patient remember when she was 4 years old, she had her lovely, lovely little doll or teddy bear, I don't remember what. And it was so dirty, and the mother threw it out. She never came over that. And she still remembered it was the worst day in her life. Emotional trauma is dangerous. Releasing high amount of cortisol and preventing important fusions from taking place. You all can feel when you have an emotional trauma. It doesn't mean you need to be close to death. It's just that boyfriend break up, you lose your job, you crash your car. That trauma creates the highest amount of immune response. Your boss is yelling you at you at work, and you cannot let go. It's in your brain, but most of it in your emotions. When we learn the patient to control the emotions, we can prevent a lot already there. It's creating inflammation in the nerve system that spreads through the whole nerve system. 20 years ago, I found out the reason for fibromyalgia. It's chronic inflammation in the nerve system. So when we treat it, today we have thousands or hundreds of thousands of fibromyalgia diagnosed from 5 to 30 years that have nothing left. Because we increased the nerve system's ability to fix it itself. Because it takes years until we have a severe symptom. So why is it so dangerous? Because it slowly affects us. And it goes 1 year, 2 years, 3 years. All of a sudden, you feel like shit. And you think it started that day. Many women, when they go to menopause and lose their estrogen, and they're changing, they get more aggressive or more depressed, or it's my husband's fault. It's not, because they don't understand. It's not the husband's fault. It's the estrogen. Estrogen is the solution for all depression. Progesterone is opposite. I have the frequency of progesterone. We can do a clinical test today and see how happy you are. You will not be happy. Moving pains like fibromyalgia, chronic disease or autoimmune disorders. What are the main causes? Number 1, emotional trauma. Mental stress, bad diet. Many people think, okay, I need to change my diet. I will become vegetarian or vegan. Sorry guys, you are killing yourself faster. Reason why, I will tell you why. Some of you are now thinking, this man is totally crazy. Yes, I am. But your body have learned from your mother that everything she eat, all the resources she have, copy-paste to you for 40 years. Have your biochemical system learn this. What is waste? What is good? How do I use it to repair? How do I fix this? Bam, bam, bam. Then you're 40 or 35, 55. Now I will change my diet. I will eat only vegetables. You are removing millions of resources. It's gone. How do you think your immune system would figure that out? It doesn't have a brain. Just because you think your liver doesn't have a brain, you're removing everything they learned like this. Same if you do opposite with meat or anything else. A little bit good, a little bit shit. Perfect. Old school. Otherwise, you will end up here. And I see it a lot. Don't teach your kids that. Neuro-frequency applied to medicine is a wearable technology, I see my time is out, sorry for that, activated by the body's infrared heat. It releases the frequencies directly in the neurological system. The neurons pick up this immediately and start to copy-paste it. How long the treatment takes depends on how long time it takes for your system to copy-paste it. The nerve system doesn't have a brain. It can only copy-paste. That's why it learned from your mother. Everything you are and what your body is, learned from your mom. It aims to repair and strengthen neurological oscillation by sending a correction frequency. It's for all ages. We treat newborn to the really, really old person. You can go on my Instagram or the company's Instagram, you can see billions of before and after things. Address and understand the importance of the neurological system. It is the main system. No, it's not nothing else to discuss. We can be specialists in different parts and different cells, or the brain or whatever, but if you don't understand this, you will not accomplish much. Controls all the biochemical function, mental and physical performance. We work a lot with mental patients as well, where we're also using this for different resources with enormous results. It's the key to longevity and optimized health. Everything we do in medical healthcare, but we need to understand the three musketeers and the collaboration. We need to understand the human body's resources, how they work, what they're doing, what is the pre-process of them, and the end process. Okay, so neurofrequencies offer solutions in these areas. And we have all of them. And I can tell you when all my colleagues, when I start to go into neurological biochemical function and the really deep knowledge, every colleague I have said, "You're an idiot, why do you want to do that? Why do you want to understand the biochemical function, collaborate, blah, 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 blah?" go and work in a hospital and have a good job or open your own clinic. No, for me, my passion, the reason I chose this job is I want to make a difference. I want to help. I don't care about the rest. This is actually, I don't do so many lectures like this either, because now I need to. Okay, so neurobio resetting 4, read it. And it doesn't mean it's not one device for everything. It's a lot of combinations. It's many, many different devices. And we are so happy to be here to release ANF CARE. Oh, I could not say that. I did anyway. Sorry. It's really cool. Emotions, but all of these is collaboration issues. Every single one of them is just an end reason of something. And we need to find out what. So why apply? Counteract obstacles for healing, maximize the energy resources, and address the root cause. First thing we teach people at our medical school, never listen to referred pain. Find the root cause. 84% of all pain we have in the body you feel in the lower back. How can you trust that? Activate the immune system response by normalizing the neural oscillation. Safe and efficient approach. No needles, no chemicals, no supplements. Because the liver is the key. Latest clinical investigation, neurological frequencies. We are working in more than 80 countries with this every single day. We just this year presented one of the best probably clinical studies ever of 43 countries all over the world. Independent therapists and doctors delivered results from their patients that was published in some of these magazines. I never remember the name. But for me, the only result that is interesting, I can read about a lot of things, but the main thing is the results I see on my patients. That's the only thing that I don't want to read about it, I want to see it. And this is another cool thing with this. Believe or not, we can prove it. Oh, sorry. Are you asleep? No? You like it? Ah, thank you. I can do it again. Okay, now. Thank you.
Thank you very much.
You're welcome. Sorry for the time. Thank you. Thank you.